Okay, I believe we're live. Good afternoon. I'm Mark Nykirk, Director of the Scripps Howard Center for Civic Engagement at NKY. Thanks for joining us. And before we start with anything else, just let me say thank you to the Health District for all it's doing right now, and also to all first responders who are on the front lines as we try to push back on the COVID-19 virus. This is our first experiment with being a virtual forum. Many of you have been with us in person, and we shall do that again someday. But for now, we are live from our offices and living rooms, and I'm happy to be with you for what we think will be an informative half hour. This will work fairly simply. Dr. Lynne Sadler, Director of the Health District, will have the floor in just a moment, and when she's done, we'll have questions. So you'll see a chat function at the bottom of your screen. Just type your questions there. We'll monitor them and get to as many as we can. And so without further ado, Dr. Lynne Sadler, thank you.
Well, thank you, Mark, for allowing me to have a little bit of time this afternoon to be able to talk to folks and hear what's on their minds as we're all going through this situation here in Northern Kentucky as part of an overall global pandemic. So I do have just a few slides to share with you all, and then we can take questions. And Chris is getting those fired up for us. Next slide. And the next slide. Okay, and Chris, is this our current data from the website?
It is, no, this is from the slide.
Yep, we'll need to click through to our website. And while Chris is doing that, just to let you know, we have a dashboard on our website, nkyhealth.org. And if you go to the COVID-19 page, just as Chris is here, and you scroll down just a little bit, you can see some of our data that we're pushing out and gets updated every day. So currently, that's great, Chris, thank you. Currently, you can see that as of yesterday, we have 72 confirmed cases. These are people who have been tested and have tested positive in Northern Kentucky. And you can see by county what the numbers look like. One thing I do want to point out is that even though these people have been tested and tested positive, there are many more people in Northern Kentucky who have symptoms. They may not have called their doctor. They may just be sitting at home and writing it out, which is a good thing if they're infected. Some people feel a little bit more ill and they do reach out to their healthcare provider. They might get an e-health visit, and their healthcare provider may tell them that clinically it looks like COVID-19, but that they're not going to order a test for it, and people will write it out at home and take the appropriate precautions at home to avoid spreading it to other people. And that's also okay, because we don't want everyone flooding the emergency departments and overwhelming our healthcare system. And for people who are trying to write it out at home, but their symptoms get more severe, then obviously they'll either call or go to or call 911 or seek emergency medical care, as they should. But we know that for most people who become infected, they have milder symptoms and they can ride it out at home. There are some people who are going to be more at risk for severe complications, and they're the ones who are going to have to be hospitalized. Some of them may be on ventilators for a period of time. And those are people, for the most part, who are over 60 or people who have serious underlying medical conditions. We have had, unfortunately, 3 deaths so far in Northern Kentucky. And you can see just about equal male, female are becoming infected. And a little bit more of the people who's you see who have cases have positive lab results. A little bit more than half have been hospitalized. There's something strange going on with the age groups graph on this dashboard, but I can tell you in general, we're seeing, there we go. Wonderful, thanks, Chris. So you can see here the spread that we've got. So if people think, well, only the old people have to worry about this, you can see here the range of people and the ages of people who have tested positive. And it's quite a range. So the younger people are getting it, people of working age are getting it, as well as the older folks in our community. And it appears that we've got our dashboard in flux because you can see that we're working on the graphing piece that will be part of our dashboard as well. So I would encourage you to go to our website, go to the COVID-19 page, check out the dashboard daily if you want to see what's the latest that's happening. It's a good place to keep up to date, and there's a lot of very credible information, handouts, and other things to help you and your families. Next slide, please. Just hold on
There you go.
here. So I just wanted to comment on something that Mark had said about being appreciative of everything the health department's doing, and as well as our first responders and our healthcare system. And I ditto that because all of us are working together to respond to the situation that we've got. But I always want to remind people that you are our first line of defense when it comes to COVID-19. And I know you have heard this ad nauseum through social media and nightly news, whether it's local or national. We really are counting on every single person in Northern Kentucky taking these actions in order for us to prevent new cases in our region, and certainly to protect the people most at risk so that we can save lives and prevent deaths. So I won't dwell too much on this slide. You know the drill: washing your hands frequently with soap and water, covering coughs and sneezes, staying home, especially if you are symptomatic, if you have a fever, if you have a cough and difficulty breathing. On a great day like this, it's fine to go outside if you're not sick, but make sure that you still maintain social distancing, you know, keeping that at least 6 feet away from other people. And, you know, think in terms of only being out for essential things, and other than that, staying at home. And then making sure that you do regularly clean and disinfect frequently touched objects and surfaces, so that if someone in your family does develop symptoms, you can help prevent the spread to others. Next slide. So in case you were wondering, well, what exactly is the health department's role been in this response to COVID-19? Early on, we did a lot of work pushing out specific guidance from the CDC and the state health department to all the different sectors of our community, including the general public, but also our local elected officials, healthcare providers, first responders, schools, businesses, social service agencies, and so many other folks, as sort of that foundation of, okay, let's get our plans together, let's figure out what we need to do to get ready for this. And since that time, a lot of our time has been spent continuing to provide guidance, continuing to answer questions, help walk people through how to handle certain situations, as well as responding to an ongoing large number of questions from the public. And we are happy to do that because we are all in this together. And to the extent that each one of our agencies and each one of us in the community are better armed and able to take the appropriate actions to prevent the spread, the better off we're all going to be. And that's really what the health department wants to see happen. We have been tasked by the governor to enforce all of his social distancing orders that he announces every day on the 5 o'clock press conference that he does, and following up on concerns from the public about businesses that may be in violation or not complying. So we do that to try to make sure that everyone who's supposed to be taking certain actions are taking those actions. Another role that we have is coordinating the distribution of the personal protective equipment from the Strategic National Stockpile, and being able to provide what is available, the N95 masks, the face shields, the gowns, the gloves, whatever is available, to get that pushed out to the people who need that the most, because they are taking care of people who have symptoms and who may be infected. And we certainly want to protect our healthcare providers and first responders. We need them to be able to be on the job every day. And then also one of the large roles we play is in terms of tracking the positive tests that come in. When we receive a report of a positive test, we reach out to that person to understand where have they been while they were infectious, who have they been around, where do they work, because we need to be able to reach out to those people and to work with their employer if they're working to really assess who has had an exposure that may need to be quarantined and monitor themselves for symptoms for 14 days. And so there's a lot of work involved in that, but that's all in an effort to try to contain the spread of disease. Next slide. And so I think this is my last slide, next to last slide. What should you do if you become sick? And I talked a little bit about this already, and this is a slide we've pushed out on social media many times, and it's on our website. Comes from the Kentucky Department for Public Health's website, just to try to help people discern when they might need to seek medical care if they're having symptoms of COVID-19, fever, cough, difficulty breathing. So if you're what the state calls the worried well, I know this plagues all of our minds, and from time to time, all of us can feel overwhelmed or anxious and worry that, that tickle in the back of my throat, is that COVID-19 and whatnot. We're telling folks, stay home because we don't want you to be spreading whatever it is that you have with other people. If you feel like you need to talk to someone to sort it through, one good spot to start with, of course, is the Kentucky State Hotline that's listed here. But if you're feeling a little bit more seriously ill than that, you might want to think about calling your healthcare provider. And when you call them, you might have an e-health visit. And you might be told, yes, stay at home. It looks like you have it. But again, if you're feeling much sicker than that, if you're feeling like it truly is a medical emergency, then by all means, you need to call 911 and be evaluated at the emergency department and let them decide what needs to happen next. And just to sort of conclude my slides, the next slide just has some different resources for you, places to get credible information. And I know all of us are being bombarded by social media and all kinds of stories that may or may not be true. So I always want to make sure people know where they can go to get good information. And I always plug our website, the CDC, the KY COVID-19.ky.gov, the state website. Those are all good places. Follow us on Twitter, like us on Facebook. We push a lot of stuff out by social media, so you get the latest and greatest there. Hopefully those are helpful resources to all of you. So with that being said, we can open up to questions, Mark, if that's okay with you.
Dr. Sadler, thank you. We have a question from someone mentioning that she has, her mother is in a nursing home in Cold Spring. I don't know if you're familiar with that, but she wondered if you can comment on involvement in that facility or other facilities like that.
So I can talk in general terms about long-term care facilities. And as you might imagine, when we talk about people who are most at risk of serious complications, and those being people over the age of 60 or people who have underlying medical conditions, you know, one of the places you may find people most at risk are in long-term care facilities. And so we work very closely with the long-term care facilities to try to make sure that they have their procedures in place for infection control and that they are using personal protective equipment as efficiently as they can, and monitoring both the staff and the residents of the facilities on a regular basis in order to determine if someone starts having symptoms, to be able to have them evaluated and tested to determine if they have COVID-19 or not. But those are areas that we're particularly concerned about. And one of the things that we want to make sure, the nursing homes, of course, can't have visitors anymore at this point in time while we're going through this. But we need to make sure that we stay on top of what the nursing homes and the long-term care facilities need to be doing on a consistent and regular basis to try to prevent any infections and prevent the spread within the facilities.
Thank you. Another question, please. We have a question from someone who works for a home respiratory medical equipment company and is wondering how they can get access to PPEs to care for patients in their homes.
So as you probably have heard or know, personal protective equipment, or PPE, is in short supply throughout the country, and that includes here in Northern Kentucky. And so any organization that needs to use personal protective equipment in the course of their jobs, of course, we're telling them, go through your usual channels to try to purchase it. And to the extent possible, we are working on trying to get it out. But even what little bit we have access to, we have to prioritize where it goes and who gets it. And so that's a real challenge. I'm looking at one of our folks here to ask, should they call us here at the health department if they are in need, and we can see if we're able to meet that need. So as I said, they need to do their best to try to find resources on their own. They can call us if we're able to provide some of what they need, then we'll do that. But they really need to work hard and keep working hard at trying to get the PPE through their usual channels.
Question on tests, when tests will be, are expected to become more available in this area for people who do not require hospitalization. Do we have any time predictions on that?
You know, that's probably the #1 question I've heard over the last month, when it will be more tests. And it's really difficult to say for sure when that's going to happen. We have seen a shift here in Northern Kentucky from having to use the state lab exclusively to shifting over to some of the private labs. And so tests may become more available through the private labs as time goes on, but it's really difficult to say how many more tests may be available and when that might be. You know, there's the test kits, but there's also the actual swabs for collecting the samples that are in short supply as well, which is why healthcare providers are telling their patients, you know, if you've got fever, if you've got cough, if you've got difficulty breathing, and it it looks like COVID-19, you should assume it is and act accordingly and stay home and stay isolated from others.
Dr. Sadler, a fairly straightforward question. It might seem simple in other times, but now a little more complicated. If you live in an apartment building, how do you protect yourself in the hallway?
Well, the COVID-19, the virus that causes it is spread through droplets. And so one of the things that we tell folks is, if you can maintain that 6 feet apart. So if you're leaving, if you're walking through, and you're not in close personal contact for a prolonged period of time, you should be fine as you walk through the hallway to get to where you're going. The key is for folks to remember it's prolonged close contact with someone who is infected. And if you're walking through the hallway and nobody else is there, you should be okay.
Follow-up question to that, if you're in the grocery store, what about in the aisle, which are often crowded, less so now, but what should our behavior be in the grocery store?
That's another great question. And, I really encourage folks to look at what options they have for either grocery delivery or just the click list and grocery pickup. And to the extent possible to avoid going into the stores, because you're right, there's certain times that you go in that there may very well be a lot of people who are in there and who are shopping. And if the store itself isn't doing a great job of social distancing people, then you need to take that upon yourself. But I strongly encourage people to look for alternate ways of getting their groceries besides being in the stores while everyone else is in the stores.
I remind everybody we have about 7 or 8 minutes left, so if you have a question, please type it into the chat. Dr. Sadler, we have this question. Is there a mechanism in place for physicians to report assumed positive cases?
There currently is not. They're required by law, the labs are required by law to report the lab confirmed positives, but there's not a mechanism in place to report anyone that's suspected of having COVID-19.
Of those who are infected in our area, do we have any sense of how that happened? Were they on cruise ships or coming from international points, or is it community involvement, or what do we know origins of those who are ill?
So I wanted to verify with our epidemiology experts here what they've been seeing with the cases that we do have. And it appears to be a combination of they don't know and we don't know. They obviously have come in contact with someone who was infected. But then there's a subset of people who were definitely contacts, had prolonged close contact with someone who was infected. It could be a family member, or it could have been someone that they were someplace at the time and the person didn't even realize that they were infected. They may have had a fever and didn't realize it, or thought their cough was something else. So really has been a combination. I know in other parts of the country, they saw initially a lot connected to travel, but it has been quite a while before we got our first case here in Northern Kentucky. And so we weren't seeing the same kinds of things that other parts of the country were.
This questioner says it's her understanding that the virus is killed by destroying its fatty lipid membrane, and is wondering if all soaps are effective in achieving that goal.
To the best
of
my knowledge, I'm looking around at my experts, to the best of my knowledge, yes, soaps will do that. And for surfaces, On our website, we have information about how you can disinfect. Bleach, we know, is also effective at destroying it as well. And that's a good point. And laundering of your clothes, the soap that you use in the laundry to launder your clothes is also effective.
We do have a question that's very related to that, and what precautions need to be taken to disinfect clothes and food packaging?
So clothing, we just said, if you launder your clothes as usual, using your laundry detergent, that will take care of it. Dry your clothes in the dryer. The other question I think you said was food packaging. Is there anything, let me ask our environmental health director, anything people need to do regarding the packaging? I know we always encourage people, you know, after you're touching something, go ahead and wash your hands again before you touch anything else, and keep your hands away from your face. Steve, is there anything else?
And also with hard surface packages, you know, I think have a package use the sanitizer wipes on that as well.
Okay, so I'll repeat that because you may not have heard that. Did you all hear that? Mark?
Repeat it, please.
Okay, so as I said, when you open that package, before you touch what's in it or anything else, wash your hands the 20 seconds, do a good job with that. If it's other kinds of packages, Steve, you were saying you could use sanitizing wipes to wipe down the outside of the package.
Question from someone who is perhaps a medical student, but in any case, the question is, are there volunteer opportunities in our region for current medical students?
I'm going to ask our someone who knows about our Medical Reserve Corps. Are we signing up medical students as volunteers at this point? Okay. We have not started signing up medical students yet, but they may want to check in with St. Elizabeth and see if they are signing up people or taking names at this time. But it's good to know that we've got folks out there who are willing to and interested in volunteering if they're needed as this continues.
Thank you. What about our pets? Are they susceptible to the virus? Take any precautions with regard to our pups and kittens?
Yeah, so, you know, there's kind of been mixed information out there at this point in time. And so because of that, I mean, I have seen articles that have said, no, it's not a problem. Animals can't get it. I've seen other articles that say, yes, they can get it. There have been questions about, should I let my neighbor pet my dog? And you know, whenever the scientific evidence base isn't clear, I always tell people, err on the side of caution and conservatism. And, you know, I think you do have to be careful and be cautious. Just as a rule, I don't let people pet my dog outside of the family because, you know, you don't know at this point. And really that's getting them kind of in close within the 6 feet of you usually. And, you know, if your dog or your cat starts having unusual symptoms, by all means, you should call the veterinarian and ask what you should do. And it could be, you know, obviously anything with cats or dogs, but I don't know that there's a clear answer yet, but it's just a mixed bag right now. And so I would just urge people to be cautious at this point until it becomes clearer.
Dr. Saylor, we have about a minute left, and we have a question about that really, there's probably a deeper question involved in this, but the express question is, are vinyl gloves acceptable as PPE, and would hospitals be interested in receiving them as a donation? And if I could extend that more generally, what can we do as citizens of Northern Kentucky if there's some way we want to help volunteer in some way or donate things? Any counsel on that would be welcome.
So vinyl gloves. So our expert is saying good for home use, but not for first responders. So, so hopefully that answers that question. And the question about what can people do? And, you know, honestly, there's probably a lot of things that might be needed as we all move forward together. But from my perspective, the single most important thing that anyone can do is to take those preventive measures, the social distancing, the washing hands, the keeping your hands away from your face. This virus, in order for it to infect you, you have to get it in through your mouth, your nose, or your eyes, into those mucous membranes. And so the most important thing, even more than donating things or whatever, is protect yourself, protect your family, and help us protect our healthcare workers, our first responders, and everybody else, our elders in the community. Take those actions, and that will be enough.
Well, on behalf of the Northern Kentucky Forum and on behalf of the community, thank you for being with us today. Thank you and your team for your service to the community. And audience, please join us at the same time next week, next Thursday, April the 9th, when Kenton County Clerk Gabe Summey will be our guest. She is the Chief Election Officer for Kenton County and will talk to us about how we are planning and responding for election preparation for the primary and general election, because the dates have been changed, including for voter registration and the election itself, and also some things that make it a little easier to vote from absentee if that's what you want to do. So everybody, we appreciate you tuning in. We do plan to post the recording, so you can come back to it or send friends to it. www.nkyforum.org is the website, and we're also on Facebook. So thanks everybody, and be healthy.